In a 2005 study, pressure ulcers were stated as being a terrible illness, and it was shown to be prevalent in as much as 23% of UK patients. 1.94 million people have been admitted to hospital, with 427,000 of them being terminally ill patients. For perspective, that number of people will fill 71.3% of Glasgow. What's more, 448,193 patients were prone to bed sores over the course of this study. This results in a large number of vulnerable people who are inflicted with a painful condition that costs the NHS as much as £14,000 per ulcer to fix. Often, even if it is visually detected, it's usually just the tip of the iceberg, because beneath there's hidden widespread damage. If an ulcer is left without detection or treatment, it gets progressively worse. They're incredibly difficult to get rid of, potentially increasing the chances of dangerous infection and amputation in already vulnerable patients, leading to immense pain and suffering. So how can we reduce the number of people suffering from late-stage pressure ulcers? And how can we help reduce the cost for the NHS at the same time? So a guy in our team called Harry is a GP with experience in diabetic wards, and he's currently pursuing a PhD in microbiotics. Harry has had an idea about an amazing piece of hardware which measures blood flow under the skin in a cheap, consumer-ready method. So our solution is Predictaview. We have built a user-friendly, cost-effective, portable, energy-efficient device that allows us to visually and numerically see the blood oxygen and carbon dioxide levels in real time from the surface of the patient's skin. However, we didn't know if this idea was valuable to the NHS. So we built a tool called Predictaview. It's a new tool that allows you to validate your ideas by analyzing open data. Predictaview allowed us to see that our product would have a large impact on long-term patients, those with diabetes and other patients prone to ulcers. This enabled us to effectively conduct a virtual clinical trial on the demographic of patients involved. We were now confident enough that with Harry's data, we decided to build it. So we now know that the effort we were putting into the device will be likely to pay off to the tune of £37.3 million in savings to the NHS. The device uses Class 3B lasers and a phone camera, which allows consumers and professionals alike to determine the blood oxygen delivery to subcutaneous tissues and carbon dioxide levels of their bodies from any location, even from the comfort of their own home. The information collected would allow accurate and instant diagnosis of restrictions to blood flow. This would allow us to predict ulcer behavior before the ulcer has progressed beyond a certain stage and affected the deep layers of tissue. This would save millions in treatment costs and end the suffering of patients. So this is an initial working model that we have. And here's some mock-ups for how the product might look in mass production. And this is a smartphone app that goes along with the product. It allows the user to easily screen themselves for illness. And there are competitors to this project, but they're all internal. And only ours is safe, inexpensive, and consumer-friendly. We're looking to open source the project. This will allow quick adoption from other organizations. Our non-profit revenue model is based on recuperating our expenditure through consultancy services for organizations who wish to implement the technology. And in the future, there are plenty other uses for this technology, such as measuring the effectiveness of treatments of wounds, monitoring the restriction of blood flow in the scalp, early detection of infections, monitoring the health of skin grafts, early detection of carpal tunnel syndrome, and even detection of certain forms of skin cancer. So about our team. I'm John. I'm a self-taught developer and I'm a business owner with experience working with companies like Arnold Clark, Eurostar, Arsenal Football Club, and many others. We have Armadeep, who is a biomedical engineer. We have Nrupo, who is a software architect, mobile app developer, and a data analyst. And we have Harry, who's a medical doctor, and he's pursuing a PhD in microbiotics. So if you have any questions, I'd love to hear from you. Thank you.
Thank you. So thank you, Predictaview. Questions, please?
Thank you very much. Very good presentation. Just wondering if you could talk us through how you would spend the investment if you were successful this evening.
Sure, thank you. So we estimate that the prize-winning money would be enough to get us to a stage where we'd be ready for clinical trials.
That sounds a bit ambitious to me.
It is an external device. It's a non-invasive device, so which can actually see the blood flow and oxygen delivery and carbon dioxide delivery at the same time. So, and all this in real time. We can see it in the display of the phone itself. So we don't even have to do animal trials because it doesn't contain anything hazardous.
Anything that can save the NHS 37.3 million makes me sit up, I have to say. Can you give me a bit more information about how you think that could be realised?
The NHS.
Sorry about that. Oh, the graph for the 1.93 million?
How will it save the NHS money? Conscious of time here, so how will it save the money?
This is how we calculated that. So we got data from the opendata.gov, and from there, what we did was there's 9 years of data. For that, all hospital admissions were calculated, and that came out to be 1.94 million. And of that, there were calculated. We took out the pieces which were terminally ill, or say, put them aside, and those came out for each person. We assume that. There is a bit of assumption because we don't know the span of how long the patients were in the hospital or bedridden. So the bed source or the pressure source developed for longer periods of being immobile on the bed. From that, we calculated per source, the chances are, we took it, we multiplied it by 750 pounds, which is even a low cost one. When we get to the next level, when these were multiplied together, I do have a graph.
I think that's enough detail, probably.
I was going into the detail.
The 750 pounds per pressure sore was a published result.
All right. Yep.
Thank you. I'll be quick, guys. The best compliment I could say, that felt like a real pitch. I'll be quick. In terms of other partners that you want to work alongside, who else do you think you'd need to work with you on this? Assuming that you won today. Because it's not just going to be, who else do you think is going to need to be part of this consortium? Who would you use? As in a design partner, do you think you'd need any kind of consultancy? Who else would you?
No. The thing is, the team is already well equipped with designers, and we've already tested the proof of concept for the technology.
Fine. So has this been part of your PhD, creating the sensor? I take it you didn't do that over the weekend. This is something you've been looking at during your PhD?
No, not really.
Right. So can you tell, well, if we had more time, I'd ask you more about the sensor technology, so I'll ask you that later.
Yeah, sure.
Thank you.
Okay. Thank you, Predictaview.